Hello, everyone. Welcome, and thank you all for joining us today. I'm Andrew Barrett, Program Officer with the Healthy Food, Healthy Lives initiative here at the New York Health Foundation. Our overarching goal for the initiative is to connect New Yorkers with the food they need to thrive, and we currently focus on four strategies: supporting food systems planning and food policy councils around the state, maximizing nutrition benefit programs, supporting healthier, culturally responsive food and food purchasing in public institutions, and promoting food as medicine interventions. Before we get started, just a few housekeeping items. We will be recording this webinar, and a recap with a link to the recording and any other materials will be circulated afterwards. Video and audio are disabled for attendees, but we do invite you to use the chat box throughout the event to share any questions you have. After the presentation and discussion, we'll respond to as many questions as we can. Finally, we have a closed captioning feature available, which you should be able to select at the bottom of your screen. So with that, let's get started. Thank you again for joining us today. We're going to discuss SNAP participation in New York State. The New York Health Foundation recently released a report examining the SNAP participation gap. That is the gap between those who are eligible for benefits and those who are enrolled in the state. The analysis found that nearly 877,000 low-income New Yorkers who are likely eligible for SNAP are not enrolled, which leaves an estimated $1.1 billion of federal food assistance unclaimed each year. Today, we're going to use the report as a jumping off point for our discussion. Our speakers are going to provide top-line takeaways, dig into some of the policies and on-the-ground realities of SNAP outreach and enrollment across the state, and highlight challenges and opportunities to address them, especially in this current context of significant federal policy changes. So I'm pleased to welcome our panelists today, and we're honored to have them join us. Emilia Cobbs is a policy and research associate here at the New York Health Foundation and led the research and development of the report. Lindsay Mehrman is the Deputy Commissioner with the Clinton County Department of Social Services. Vanessa Baird-Streeter is President and CEO of the Health and Welfare Council of Long Island. And Whitley Hasty is the Benefits Navigation Manager at Foodlink in Rochester. So first, I'm going to turn it over to Emilia to introduce herself and share findings from the report, followed by a conversation with our awesome panelists. So Emilia, take it away.
Thanks, Andrew. Again, my name is Emilia Cobbs. I am a policy and research associate here at the foundation. Let me pull up my slides. So I will be discussing, again, this report that came out this spring. All right. One second. There we go. Which is Understanding the SNAP Participation Gap in New York. So Andrew already did a little overview, and many of you all know the role of food insecurity and SNAP in New York. However, I will do a little information just as a little primer. So food insecurity affects about 2.8 million New Yorkers every year. That's about 14% of the population. And it is found that uncertain food access affects lowers diet quality, has worse health outcomes, and higher healthcare costs. And it also disproportionately affects communities of color. SNAP is the country's largest and most effective anti-hunger program. I think we all here know how important SNAP is. And research has shown that SNAP can reduce overall food insecurity prevalence as much as 30% and improve racial disparities in food insecurity. It's also been found to improve dietary quality, support positive health outcomes, and lower healthcare expenditures. And food insecurity is, still a public health challenge in New York. SNAP is an entitlement program, so anyone who meets the eligibility requirements have a legal right to receive the benefits. And as you can see on the right, just a little breakdown of who uses SNAP in the state, mostly children, older adults, and people who have a disability but are not older adults. Looking at how SNAP eligibility is determined quickly, I know many of you know about this, but the main parts are income, assets, household size, disability, age, and immigration status. So for most households without older adults or individuals with disabilities, the income requirement for eligibility is at or below 130% of the federal poverty level, or FPL. And for older adults and households with someone with a disability, the threshold for income eligibility is at 200% of the federal poverty level. So not everyone who needs SNAP is able to apply for and maintain benefits. And barriers can make applying and maintaining benefits more time-consuming than the amount of assistance someone may receive. Examples of barriers, I have some examples on the left, such as limited awareness about eligibility, issues navigating the application process, and technology and transportation limitations. These are just some examples. There are many more that we discuss in the report. There are several programs that help New Yorkers apply for and maintain benefits, the largest of which is the Nutrition Education and Outreach Program, or NOAP. And the navigators help with anyone. They reach out to potentially eligible New Yorkers and give any troubleshooting, help them retain their benefits as well. And I'm sure many of you know about another thing that is shaping access, which is last year's HR 1 bill, federal bill, and that has significant changes to SNAP, among other important programs, as it's shifting a greater share of program costs to states, in part based to administrative performance measures. Also, it expands work requirements and adds new eligibility restrictions. And many of these changes have already been put in place and are already affecting New Yorkers accessing SNAP. So we needed some kind of way to measure this gap in participation. So what we did was operationalize an indicator that was created by the USDA a while ago and is still being used by USDA and New York City's Human Resources Administration. That's called the Program Access Index, and it measures SNAP participation among low-income residents by comparing the average monthly number of SNAP participants to the number of individuals who have incomes up to 125% of the federal poverty level. We adapted it by including the eligibility criteria for the older adults, which I mentioned is up to 200% of federal poverty level. So that's what we call the adapted PAI. And that better reflects that eligibility criteria for older adults. And so we made this adjustment to more accurately assess SNAP participation, particularly with older adults. However, it doesn't account for all eligibility factors, particularly for people with disabilities and also for immigration status. One thing to note with the PAI is that it is a value usually between 0 and 1, although it can sometimes be greater than 1. And if the value is closer to 1, that means this participation gap is smaller. So another thing to note is that this is 2024 data, which was the most recent SNAP participation and census data we had available at the time of publication. And then on the right is a simple equation of how we estimated this number that we call unserved low-income New Yorkers and the SNAP participation gap. So we wanted to map where these potentially eligible low-income New Yorkers live. Here on the left is a map. It's just pretty simple. Light blue means a lower share of low-income residents, and darker blue means a greater share. Again, this is up to 65 and 125% based off of this adapted PAI that we created. And you could see that low-income New Yorkers who are under 65 are primarily in the New York City area, as well as in several regions upstate. Oh, sorry. So we also looked at this group of older adults who are 65 and older, up to 200% of federal poverty level, Again, light blue means a lower share of older adults who are within this eligibility criteria. Darker blue is a greater concentration. Again, we're seeing older adult need around New York City, as well as some more rural regions upstate. And then we actually looked at this statewide and kind of quantified this. We know that 2.8 million New Yorkers receive SNAP every year. That's great reach. And that means that $7.4 billion in SNAP benefits are received by New Yorkers, are given to New Yorkers every year. And we came to an adapted PAI value of 0.77. That is equal to about 1 in 5 of these eligible low-income New Yorkers who are not getting SNAP, even though they have this criteria based on income. And as Andrew noticed, it's more than 876,000 New Yorkers who are low income and unserved. And that would be equal to about $1.1 billion of missed SNAP benefits. And SNAP actually generates economic activity. So every $1 spent on SNAP generates $1.54 in local economic activity. So using that, we factor, that means that New York is also missing out on $1.7 billion in missed economic generated activity. So we also wanted to map out what this participation gap looked like at the county level, the adapted PAI. Again, if it's usually between 0 and 1, and if it's closer to 1, that means that fewer people are unserved. There's greater program reach among low-income New Yorkers. So in the map, a lighter green means a lower PAI value or a larger participation gap and lower program reach. And you can see with the darker colors, meaning the higher PAI value, urban counties tended to have a smaller participation gap, while more rural counties often had a larger participation gap. And one thing to note that is different from national trends is that New York has higher urban participation generally and lower rural participation. And that is the inverse of most national trends, where there's higher rural participation, lower urban participation, which is just an interesting difference in New York State. And this variation really reflects that there are so many different differences in outreach capacity, administrative systems, and also the different local opportunities that can help strengthen enrollment in SNAP. We also looked at NOAP and how their funding has helped New Yorkers across the state. Again, it's the largest outreach program for SNAP, but not the only one. And you can see here the map on the right, that is the in-person contractors. Most counties have at least one, but some rural counties have only access to remote NOAP services. Everyone has access to remote services. New York City, you can see there are quite a lot. So we just counted all the different subcontractors within New York City into one entity. And $6.46 million were awarded to NOAP in 2024. They reached out, they assisted actually over 30,000 households to enroll in SNAP, and they contacted over 100,000 to check their eligibility. And that led to $131 million in food purchasing through SNAP. Again, with that economic multiplier effect of SNAP, that generated $201 million in economic activity. And those going to grocery stores, farm stands, our local communities. So we will hear some recommendations from our panelists about ways that we can improve SNAP in New York. But the key areas that we focus in on in our report are federal policy changes to restore funding, state level enhancement of administrative systems to improve enrollment and retention, as well as to build out data and monitoring systems so we can monitor SNAP and food insecurity. These recommendations help advocates and government leaders to understand and meet the food needs of New Yorkers in the face of federal changes. Thank you for your time, and I look forward to discussing in the Q&A section.
Great. Thank you so much, Emilia, for sharing that analysis. I'm going to warn, it sounds like they might be having a fire alarm test here in our office today, so I will let you know. Zoom does a pretty good job of cutting out background noise, so hopefully that will be the case if they start going off. Again, thank you for the analysis. I think it really highlights some of the equity challenges, the need for additional support for food access programs across New York, the important role of SNAP outreach and navigation, and also the economic opportunity to bring more federal dollars into local businesses across the state. I do want to flag one note in the chat. I think Mary with our team here at New York Health answered, but in case you wanted something to add, since they were asking about the PAI being greater than one, and just to make sure we emphasize that that is not about people accessing benefits who should not be accessing benefits. But I don't know if you want to add a little bit more to what Mary has put in the chat, or totally up to you, just for clarifying.
I have to find that message first. I'm glad to see the chat is very active right now. But I might be repeating what Mary said, but because it's not a true indicator, there are more people who are eligible for SNAP because one, we're using 125% of the federal poverty level. There are people who are with 100, it's actually 130% for most residents. And then there's also people who have, people with disabilities, also older adults and other different things that may affect it. So that is more of a conservative estimate, which is why we actually might be getting like occasionally something greater than one. Where it's just one way to measure. It's a rough measurement of SNAP. It's participation. In the literature, it's very hard to do that in a timely manner. You kind of have to make like a really, really fancy model. So it is just kind of, it's more of a way to compare different counties and participation to each other than a true measurement of participation among like the truly eligible population.
Great. Thank you so much for adding and clarifying on that. So I'd love now to turn to our panelists to discuss a little more and kind of just to get us started, I would ask, please introduce yourselves, share briefly about your organization or agency you're working with and your work related to SNAP outreach and enrollment specifically. And I was thinking maybe we'll just start by going alphabetically here. So maybe with Lindsay, then Vanessa, and then Whitley.
Sure. Good afternoon, everybody. Thank you for being here. I do apologize for not having a camera. My name is Lindsay Mehrman, and I'm the Deputy Commissioner for the Clinton County Department of Social Services. Clinton is a rural county in northern New York that borders Canada. I have been with the department for about 18 years, many of which were spent in the eligibility departments that included SNAP eligibility and distribution. So yeah, happy to be here.
Hello and good afternoon, everyone. I'm Vanessa Baird-Streeter. I serve as the President and CEO of the Health and Welfare Council of Long Island. We have been servicing the Long Island community for over 75 years, really with the initial mission of really helping vulnerable populations navigate complex systems and being a voice for those who don't necessarily have a seat at the table. From the standpoint of the work that we're engaged in, we are SNAP navigators. So we had currently a no-up contract with the state, subcontracted to Hunger Solutions, as well as a T-SNAP contract. And so we are engaged in education and outreach, 3 prongs of the work. Pre-screening, which I think is the most important prong of the work, to ensure that household has the fiscal framework to ensure that individuals and families are eligible for SNAP, and then SNAP assistance and enrollment. In addition to our SNAP work, we're also navigators for the New York State Marketplace, facilitators for the Age Blind Disabled program. We have a maternal health arm of our work really focused on expanding the doula workforce. And we also serve as the social care network for Long Island under the auspice of the 1115 waiver. So I'm happy to be here with you today and to engage in a discussion that hopefully will be fruitful for myself as well as you. So thank you.
Great. Thank you so much. Whitley.
Hi, everyone. Thanks for joining. There's tons of people joining us today. I really appreciate everyone's time. My name is Whitley Hasty. I am the Benefits Navigation Manager at Foodlink, which is the regional food bank, Rochester-based nonprofit regional food bank, and we service a 10 county service area based in Rochester. We serve as the hub of the regional emergency food system, so through like direct service, community partnerships, advocacy. But our benefit navigation team does, similar to Vanessa, provide NOEP services currently. I have a team of 3 navigators that do community outreach, education, presentations, and one-on-one tailored assistance for SNAP navigation. So, and alongside the other programs that Foodlink has throughout the 10 counties, mobile farmers market, we have dozens, hundreds of partners that help us conduct that work.
Great, thank you so much. So as you all heard, we have panelists here that are working in very different places across the state, urban, rural, different regions. So just, I think maybe as a starting point, it might be helpful to learn kind of from your perspectives in your role in your region, kind of what are the biggest barriers you're seeing that are preventing eligible individuals and families from enrolling in SNAP, right now in this moment, and who's being missed and why. And maybe we can start in the same way and alphabetically. So maybe with Lindsay.
From my perspective, I would say maybe the biggest barrier that I see is eligibility rules can be very confusing. They're evolving, they're changing. I think sometimes consumers get frustrated with that. I also think that there's eligible groups who may not realize they're eligible, some working families who may think they're over the income thresholds, or also the seniors who just may not assume they're eligible due to their retirement income. They may think because they own a home, they're not eligible. So I would say probably working families and seniors.
From our perspective, I agree with Lindsay concerning the populations that may think they're not eligible. However, what we've seen on Long Island is your mixed status households as it pertains to your immigration status. And so, we've heard a lot over the last year and a half about sharing of information and is my information protected? Is it private? If I attempt to receive this public benefit, is my information going to be shared and I'm jeopardizing my family? So we really have seen many people, and I'll give an example, the initial executive orders that started coming out in the beginning of 2025. In certain places, we co-locate our services within 24 organizations so that we are really in community. And there were certain locations where we would see 30 clients per day, and we started to see 3. And so people were fearful, one, of coming out. And so we quickly had to pivot how we engaged in our work. So ensure that we can do it in a virtual format, in a virtual fashion, so people could still get access to the resources that we have. We could still provide the assistance, but do it in a virtual format. But then we just heard from many of our clients and our community members that they didn't want to apply because they themselves, the parent, might not have the appropriate immigration status, but their child does. But then in giving that information, they felt like they were not protecting their families. So for us, that was one of the prominent issues as it pertained to, or barriers as it pertained to accessing eligibility and really ensuring that you'd get access to the benefit.
Great. Thank you so much, Vanessa. And yes, I can't imagine being a mixed immigration household in this current climate where, unfortunately, even folks who are here as asylees, and other have been cut from these programs when they have previously been eligible. So clearly a lot of like confusion and concern and nervousness and fear that has resulted from some of the policies at the federal level. Whitley, I'll turn it over to you to kind of share what you're seeing on the ground in your experience.
Yeah, I would say similarly, from our perspective, biggest barrier to SNAP enrollment is really not about eligibility. It's a combination of a lack of awareness, stigma, hesitation to participate, and just difficulty navigating the complexity of applying and maintaining benefits. So Yeah, older adults often assume that Social Security income makes them ineligible. Working families and low-wage earning workers don't realize they qualify because they possibly think that if they're employed, they're already ineligible. And then sometimes people's income, especially with wage, like gig working, income fluctuations make it difficult to keep up with the frequency of reporting, and then they're just hesitant overall because they don't know how to do that. I would say too, in conjunction with this, this report, I know that the Map the Meal Gap data was just released last week, and it similarly indicates that, a critical point, right? A substantial share of people experiencing food insecurity fall outside of traditional assumptions about who needs assistance. So across our service area, 37.7% of food insecure people are above the income threshold for SNAP. And at the same time, many people who are eligible still remain unenrolled because they don't know that they qualify. So it's a lack of information, a lack of awareness, and a lack of infrastructure there's opportunity for strengthening the infrastructure for navigation services that just make awareness more accessible, more widespread. So I would agree.
Great. Thank you so much, Whitley. I'm going to note as we keep talking here, I think there's a couple of hands raised, but I just want to name that we don't have video and audio for participants. You are welcome to use the chat for any questions you have, and we'll try to get to those as we get to the end of the discussion, or as it makes sense as we're talking. Thank you, Whitley, for all that. Vanessa, speaking of some of these, the mixed immigrant status, other challenges, I know you and your team at Health and Welfare Council of Long Island have been really, working hard to provide resources and support during this really confusing time for SNAP participants. Again, mixed immigration status households, other underserved communities that really need that local CBO, like places where they're showing up and people who know those communities to reach out and connect. So just, an opportunity to share kind of best practices, kind of what outreach strategies have been most successful for you in reaching eligible households, building trust in your community and kind of bringing people in.
Thank you for the question. I think we are fortunate from the standpoint of the Health and Welfare Council, which I didn't mention earlier, that we're an advocacy organization for about 100 to 150 nonprofits on Long Island. And so we have a collective of organizations. Now, not every organization, and they're not engaged in SNAP enrollment or SNAP navigation or SNAP education. However, it is important for us to arm them with as much information as possible so that they too can be ambassadors of the information and sharing that these individuals can be eligible. You should seek the assistance of organizations that are navigators, that are engaged and can assist with applications. So we really do use our network of community-based organizations as ambassadors to the work that we're engaged in. And so as much information as we have, we make sure that our network is fully aware. And so therefore, it's not just our one organization that's serving in that capacity, but now I have 100 organizations that know about the new SNAP work requirements, what those work requirements are they, how they can assist in reference to ensuring that people are meeting the work requirement, or they're engaged in a workforce development program, or they're engaged in volunteering. And so from the standpoint of the work that we do, it's really a collective. We all have to be in this together, even though that may not be our particular service delivery model or the services that we're providing. But in order for us to really serve our community members, I might be a mental health organization and providing behavioral health services, but I'm going to be serving people who are SNAP recipients. So if I have the flyer that we've shared with the new work requirements up in my office, when the person comes in, they can look and say, oh, I actually need some information about that. And then they can refer them to our agency. So we really try to ensure we have far-reaching tentacle within community. I think the co-location of services, and when I say there's 24 organizations that we work with, that doesn't mean we're there every day. We might be there, in some instances, we might be there every day. In some instances, it might be twice a month. But the fact of the matter that they know that they can come to that organization while they might be trying to assist or receive food, clothing. They also know that they can come to that organization to receive SNAP assistance. So it's really, for me and for our organization, it's really about the collective of working together and everybody realizing that they're part of the solution to ensure that people know that they're eligible or just consider reaching out to organizations as it pertains to their eligibility status.
Great. Thank you so much, Vanessa. And I do want to elevate one question in the chat that is related specifically to immigration status and public charge. The administration has put out rules. The first administration that, ended up not moving forward. I think the change this time is a little different in the sense that they're not making a full rule, but giving individual sort of what feels maybe like arbitrary guidance to people who are making those decisions on the one-to-one sort of level. But I guess, do you have any thoughts or perspective on how that sort of public charge, the new information coming out about public charge rules, other than sort of adding to the fear and confusion, or have we seen any direct, and anyone I guess can answer that, have we seen any direct impact right now because of how that's happening or what has been communicated, or how we're communicating those with communities right now?
I think from the standpoint, and Whitley is going to be able to speak to this well because she does this on a consistent basis and a daily basis. But I think from the standpoint of our staff, we make sure that they are educated and fully understand what the new requirements or the changed requirements or the amended requirements, what they are, so that they can dispel the fears that our community members may have and ensure that they fully understand. We haven't necessarily seen many issues as it pertains to the newly shared public charge or the amended public charge. We haven't necessarily seen particular issues, but from the standpoint of our staff, we just ensure that they are fully aware. So therefore, when they're getting questions, our staff can answer those questions so that people don't necessarily feel that they're in the abyss and they don't really know. But I'll defer to Whitley on that as well.
Yeah, absolutely. I think, trusted institutions in our communities, these like touch points where folks are already embedded in and turning to on a daily basis, schools, they are really the strong points of where we can help correct misconceptions. I think, the strongest role we can play is just partnering together and make it, to go back to the original question, there is a lot of fear that, there's a lot of hesitation and just outright non-participation because of recent changes. And so working with our partners that have had these families as part of their programming since before these changes is really crucial, because building trust is first step. So that's where we start.
Great. Thank you so much. And, speaking of sort of your capacity, both, Whitley, Vanessa, in terms of outreach and enrollment, the NOAA program, as we mentioned, has been the largest program in the state. And the state recently made some changes to that program. And so just wondering if you want to sort of talk about, kind of where things are right now. Legislators in the last budget did add additional dollars for the NOAA program, but we're not sure exactly sort of how that's going to be allocated yet. I don't know, maybe you have new news on that front, but just maybe talk about what the NOAA program, used to look like for your funding and contracts with the state. And I know Hunger Solutions New York was the original contractor for that, and that's changed a little bit. Just if you want to elevate some of those shifts this year that are happening with NOAA with the state.
Andrew, I thank you so much for that. And I'm pretty sure we have organizations on here that have probably opted not to be a part of the new NOAA contract. And so for us at the Health and Welfare Council, we had two contracts. One was a NOAA contract that was fully funded, and the other was a TSNAP contract that we had to have 100% match. And so we were able to manage. We've been navigation for SNAP assistance and providing benefits enrollment since 1985. And so we had figured that out. We figured out our fundraising cadence to be able to come up with that 100% match. In January of 2026, the new RFP came out for SNAP navigation. And now, due to the implementation of HR 1 and the change of federal funding formulas, and the amount of funding that states receive for the administration of the programs, that contract now was changed to a 75% match. So the state was going to reimburse you 25% of the cost associated with the implementation and the operations of the program. That was a really hard pill to swallow. It was like, wait, we're contracting with you, and we serve as a subcontractor to Hunger Solutions, and they're a great collaborator to work with. But we're contracting with the state, but we're only going to get 25% reimbursement. So what does that mean? That means we need to go to our foundation community. That means we have to be creative and innovative in the grant opportunities that we secure so that we can perform this work, because it's so important now more than ever, because now you've recently implemented new work requirements for subsets of the population that weren't previously required to work. So it's creating more uncertainty. And so we served as one of two contractors for Long Island, and the other contractor had indicated that they were not going to submit for this new contract that starts in October. So I really, the decision from the standpoint of leading an organization, we had to make the decision that we were going to commit to still doing this work because it's needed, and it's needed now more than ever, particularly on Long Island. The high cost of living just exacerbates all issues. And so I had to have a tough discussion with my board and say, I'm going to do, and we're going to do everything that we can possible to ensure that we're going to be able to raise the 75% match. And so that is a little nuance that has happened in the midst of changing requirements as it pertains to SNAP. Also, the funding formula has changed. And it's unfortunate. So I'm hopeful that the additional funds that the legislators were able to put in the state budget helps to reduce that 75% match to hopefully maybe 50%. But if you think about it, contracting with an entity and you have to raise the funds to be able to do the work doesn't necessarily make the most sense. But the work is so important that you have to figure out how you're going to do it so you can best serve your community members.
Great. Thank you so much, Vanessa. And yes, I know the state had been planning to sort of combine the TSNAP and NOAA to make the process a little more consistent and streamlined at the same time. They had been planning that for a long time, but unfortunately the timing, the federal cuts and the timing in terms of this is a very confusing, difficult time. So a moment where we need as much outreach and clarity and support as possible definitely was a perfect storm in an unfortunate way. I don't know, Whitley, no pressure at all, but being part of NOAA for a long time, just curious how those changes, you're seeing how that's impacting your work.
Yeah. So Foodlink, we were fortunate to be able to extend our NOAA services through this 3-month period of uncertainty. We're only recently were notified that we were awarded the new nutrition navigation direct service opportunity, and I'm personally really excited about it. I'd like to also highlight, as well put as Vanessa laid it out, that if we really want these efforts to have a long-term impact, we need funding structures that recognize the realities facing community organizations. And so it's really difficult for nonprofits to sustain that. So we're looking forward to seeing what opportunities this will bring, because as the point of this discussion today, information only works when people can understand it. We need this work to continue. So.
Great. Thank you so much, Whitley. And I know, with New York Health Foundation, we tried to leverage a little bit of our network when we found out about these changes. It was also only a few months before the RFP from the state had come out. So we did our best to reach out to other funders across the state, let them know about this change. And, hopefully we're able to support some of this transition with that outreach. But yes,
I just need to interject for a second, because you did a great job. And so when we were then going to meet with funders, they're like, yeah, we actually heard about this already. And so we really did that work, that groundwork for us, so that when we were going to explain what it wasn't new. because it doesn't really make great sense. So the fact of the matter that you had done the outreach to the funded, to the funder community and the foundation community was really helpful so that they had a foundational understanding. And so that when we went to the organizations to explain what was taking place, it was an easier conversation to have because you really did, laid a lot of the groundwork for us.
Great. That's great to hear. Thank you so much. Just to transition a little bit. I am going to name Connie. Thank you for sharing for public charge and keeping up to date on some of that current information. Flag that Hunger Solutions New York, the National Immigration Law Center have some information on that. So that's a great resource flag. Really appreciate that. To transition a little bit, Whitley, you've been working at community-based organization for a while. You're on the front lines of food access, benefits navigation, both NOAP and other programs. But how do you think local agencies, community-based organizations like yourself, schools or other institutions in the community can really play a stronger role in SNAP outreach, communication, enrollment?
Yeah, I hope this doesn't sound repetitive, but the strong our team focuses on retention and not just enrollment, right? Many households lose benefits because they miss recertification deadlines. And the strongest role that navigators and community-based SNAP assistance workers can do is not create more work for local departments of social services. Really proud of Monroe County. We partnered with them on other so many community organizations outside of just like the county that I could spend my time mentioning and thanking that, helping local residents understand their eligibility, gather required documentations, utilize our, we created a SNAP line dedicated to create a referral system and a dedicated email line that our team monitors and tracks, and also partnered with the city of Rochester and Monroe County to create SaveMySnap.org to highlight local resources and help people understand information. So, but I mean, going back to the original question, meet people where they already receive services. Schools, health centers, senior centers, food pantries, libraries, housing providers, help expand that one-on-one navigation assistance. So a lot of eligible households are just intimidated by the wealth of information, right? You can tell someone to go to a website and scan a QR code and call. Here's a phone number. Here's an application. I have a paper application. I can go to a back to school event and have every single thing that they need, but it's that one-on-one personal conversation, and then that person will refer. We have many folks come to us saying, my neighbor, my friend, someone that cares about me or I care about told me that you guys are a trusted place to go, right? That's more likely to be the successful household that maintains benefits. So the people that are really at risk of losing their benefits are already in these places that we need to uplift. So I think that's the biggest thing. We try to stay out of the way, utilize as many training opportunities as we can with the county, and then communicate that the changes and the policies and the resources in a way that feels, keeps people's dignity. So that's what I think that a lot of organizations should focus on, or a lot of communities should focus on, is the partnerships and retention rather than trying to get new SNAP enrollment. But that will come too. But we lose a lot of people through not following through.
Great, thank you so much. And yeah, I hear you on the one hand holding the retention question, because you do have to recertify and you do have to keep your documentation updated, and all of that. So that takes extra work and investment. But as we saw in Emilia's numbers that she shared, for the $6+ million that we've invested in NOAP, we're getting millions more dollars in local federal dollars coming into our communities, supporting groceries and other food businesses. So just really highlighting that investment has a very strong return. So just thinking about that as we're, talking to decision makers about the state budget and where dollars should be allocated. Um, I'm just going to elevate a question in the chat, Willie, specifically around CBOs bringing information to local school open houses. I think anyone from the community could probably do that. It's maybe finding the right one pager, the right support, maybe to do that. But if you have anything to add specifically about that.
I think that's what we have to do, right? When I
Yeah.
talk about the collective of all of us. And so we try to create one pagers. We create them. Hunger Solutions creates them. Even with summer EBT, one pagers that go out prior to school ending. So it's in the communication that they're receiving ahead of time. But yes, the one pagers I think are important. I think we always have to keep in mind language access, right? So ensuring that we have it in multiple languages so that we can ensure that our communities can be served. And then also thinking about the disabilities that are associated as well. So thinking about if you're visually impaired, what the font should be, what the size of the font should be, just to ensure that everyone has access at the same time. And so, yes, always you're going to school open nights, you're going to the back to school rallies, you're going to every single fair and resource fair that is had. You're collaborating with other organizations when they go. So sometimes we will share our calendar with other organizations, and other organizations will share their calendar with us, and sometimes we'll share a table, right? So we'll share a resource table so that we can ensure that we have about 150 events that we can do throughout the year, because you have to meet people where they are. They're not going to necessarily always come to you, but if you go to them first, they will definitely then come to you when it's time for that recertification, because they feel like you're trusted, you honor what you're going to do, and you make sure you get them connected to a benefit.
Great, thank you so much.
I will
Whitley.
just add, yeah, thank you. I will just add that yes, absolutely. I agree with Vanessa. They're not, I know. What was I gonna say? We have dozens. This is one of the busiest times of the year for local organizations and schools to request our team to come and table and provide outreach and information and connect with families face to face. And I'm sure that many are aware of, like, in your area, like schools, zones and buildings restructure and close and change all the time. So those liaisons, those PTO groups, right? Those PTSO groups, those leaders, the parents in the community, especially the school liaisons, I think are the ones to reach out to and say, hey, did you know this? Have you seen this? I would say, answering another question about like one pager, if you're upstate in Monroe County, we did, like I said, create savemysnap.org. That is a great place to go. Foodlink will continue to invest in savemysnap.org, but our goal is that it shouldn't just be a patchwork of regional resources, right? Because everyone deserves the trusted where to go source for SNAP information, regardless of where they live. But yes, please, make a list, and we do a lot of boots on the ground. Take some of that stuff to your local school organization and reach out. I know, I will lastly say, one of the biggest events we have is Rochester City School District has a new teacher orientation event where the district brings in vendors for all of the new educators most of them are new. They're not from the area. And we love being there because they get to learn about the food landscape, the emergency food system landscape here. So there's an idea to look for things like that.
Great, thank you so much, both of you, for sharing all that. I want to turn to Lindsay. As a local Department of Social Services, does this align with your experience in your work with the county? Are there other ways that you've partnered successfully or would like to partner with local organizations, schools, others in the community to support your sort of outreach and enrollment work?
I mean, I think that we do a really great job for being such a rural county. We have a great partnership with our local OFA, which is the Office for the Aging, who are really able to connect with the senior population. We also have a great relationship with JCEO. I believe they have about 7 or 8 satellite sites speckled throughout our county where people can go and apply for benefits. We work really well with other local community organizations for clients who require extra supports to make sure they're getting the assistance they qualify for those benefits. But, to piggyback on what Vanessa and Whitley said as well, I think that partnerships that go beyond referral relationships are really equally important. Get everybody at the table, get your community organizations together and really have those conversations on how we can best serve our population.
Great. Thank you so much. And sort of just sticking with you here, Lindsay, building on that work, your work at a local Department of Social Services, New York State is unique. We're only one of 10 states where SNAP benefits are administered at the local level, so at the county level or New York City level for the city. But this state also plays a key role in shaping program administration and kind of what the program looks like in New York State and the resources that are out there. Our team at NYHealth, we've been in conversation with the state. We've talked to New York City HRA. We're talking to others about, opportunities that we as philanthropy can kind of support our county administrators. We funded, membership for all the New York counties with the American Public Human Services Association, which sort of provides technical assistance and peer networking and support for counties to sort of hear about best practices across the country. But what are some of the specific challenges and needs that you have as a local agency? What are some of the ways that the state's been helpful in navigating those? And, if you see opportunities both for the state or even philanthropy or others, to help you address those challenges you're having at the local level, again, especially in the context of this moment where we're going to face administrative costs and SNAP cuts and all the confusion.
Um, Well, to start on a positive note, I will say, and I think most people can agree, that New York State does have one of the strongest SNAP programs in the country. I think that, we should all be proud of that. OTDA has been really great in providing us with the up-to-date policy changes. They've made themselves available and supporting us, with the questions that we have. We've had similar questions to the questions that our consumers have with these changes. It's new to the local districts as well. So we've also seen some challenges with retaining experienced staff. We've seen challenges with, training new staff while maintaining the service levels, while also implementing these new policy changes. They require staff to be constantly pivoting, constantly learning, and it's been a lot for the local agencies as well. I do think, though, for some opportunities, like I said, really talk to people within your district, but also reach out to other districts, who may be able to offer some guidance and things that have been working for them in the distribution for SNAP, and kind of go from there. I don't see the changes going away. So I really think we just need to work with what we have.
Great. Thank you so much, Lindsay. And I know, as I mentioned, we've been exploring opportunities with OTDA and New York City and other counties to see if there are opportunities to create better training resources, support for example, the human services staff that are trying to process these applications and work through some of these new documentation and new details as they transition in these roles. So thank you so much for sharing that. We're actually running short on time. Part of it might be because I've sort of been trying to answer questions as they come in the chat. I see many more, but before that, I do want to elevate, we saw the USDA cancel the Household Food Security Survey. That was an important resource for understanding both national food insecurity, but also state level. There was a bill that was passed. I haven't seen any updates on whether it's been signed by the governor, but essentially including the food insecurity, some of those questions, validated questions from that USDA survey in a state what's called the BRFSS, or the Behavior Risk Factor Surveillance System Survey, which could give us county level data for New York State and continue to have that data. So just want to elevate that for folks so that you know that that's a bill that has been passed and is there, and hopefully data that we'll be able to get moving forward in New York State, despite the national survey being canceled. But to that end, I just want to, Vanessa, if you could respond, just thinking about how we value data. I know that's something you do. You value data. You want to invest in technology to support you. Again, I'm talking about, county level support. There might be technology opportunities, and I don't want to say like, oh, AI is going to save the world or tech's going to save the world, but like there are, important opportunities to leverage technology and data to just inform the work that we're doing. So just what are some of the things you're doing now? Or is there anything you wish existed that could support your work, with SNAP participants?
So I think, we have to be as strategic as we possibly can when you're talking about recertifications every 6 months, 12 months. We wanted to invest in a CRM platform for the individuals that we are serving to make sure that we can send a reminder a month ahead of time, right? So that you can have all of your paperwork together so that when it's time to recertify, you can do so. But you also want to have the technology platform. What we did is with the implementation of the new work requirements, and I did see in the questions that somebody asked, are we talking about the work requirements? But what we did was when we saw the populations of individuals and we saw what the work requirements were, either working, making $217.50 per hour, participating in a workforce development skills, upskilling for 80 hours a week, or volunteering, depending on what your monthly benefit is, we created a platform called longislandjobs.org. And so that platform has currently about 160 jobs that are in the health and human services sector. But then it also has, under the resources tab, it has all of the workforce development programs as we continue to add to them. So the workforce development programs, education and training programs, our local departments of labor, both in Nassau and Suffolk County, as well as other resources so that people do not have to navigate and try to figure out the 5 or 6 places that they go to access the information, putting it all in one place. The additional thing that we added to the platform was all of the required documentation, whether you're working, whether you're fulfilling it via education, or whether you're volunteering, all of the required documentation on that website as well. We know sometimes from the standpoint of local departments of social services, they are mailing information to the community members. Well, a lot of times you're not at that same address, right? So therefore you don't get access to the documentation. And therefore you say like, I didn't get that, right? I'm going to recertify. I don't know whether I'm ABOT or not. So we put everything on this website. Hopefully I'll share the link, but I want it to be a model. Like it's not ownership of ours, right? I want it to be a model for other communities to create something similar so that you have one place to go, one source of truth. People are not navigating all over the place. We have one-pagers that are on there. We have links to the New York State Department, OTDA. So just trying to make it easier for people. We know that it's chaotic and uncertain times. So I try to be very pragmatic in our approach as to how we approach the work and what we do to really address the new requirements that are being implemented. So a CRM platform is extremely important for us because we can proactively communicate out to the individuals, our community members that we've served, to ensure that they know their recertification dates, because we reach back out to them to find out when they were approved, so we can auto-populate that in the system, and then creating a platform called Long Island Jobs, which overall it's a workforce development initiative, but particularly designed to assist the SNAP recipients. And now we know with Medicaid starting in January of 2027 that work requirements and community engagement are going to be a requirement of that benefit as well.
Great. Thank you so much. No, we are at time, but I do want to do maybe one last question for you all. Hopefully something quick. If you want to share, I'm going to give you 2 options. One is if you could implement one policy, operational, programmatic change at the state or local level to increase SNAP participation, regardless of what is happening on the federal level, what would it be? Or what is one action that you would like to share with attendees that they can take now to strengthen SNAP outreach and enrollment, in their own communities?
I've been doing a lot of talking, so I'll defer to my panelists.
I'll go ahead. Honestly, I really just think that simplifying the eligibility process would make things much easier. Recertification periods being the same across the board, what people need to provide as far as information. I think that each process that we can streamline will eliminate barriers for these folks.
Great. Thank you so much, Lindsay. Whitley, Vanessa.
I would say, I mean, we've already spoken about it a lot, but obviously just investment. There's lots of opportunity to invest and expand community-based SNAP navigation. And then I would agree with Lindsay that I think, there have been initiatives in the past. I still think there's great opportunity to combine programs with adjunct eligibility factors. And then I say if anyone listening wanted to do one thing right now, the easiest action you could take is to start just talking about SNAP. There's still a lot of stigma about SNAP. It is a supplemental program. It is not, it is for working people who need to feed themselves. So if we can reduce the stigma, share accurate information, it's one of the most powerful things that we could do.
I think from my perspective is find out who your NOOP organizations are within your region, reach out to them, establish partnerships and relationships so that you have a referral pathway. You're also educated, so they're not the only organization that's educating, but they're providing you documentation that can actually assist in you making referrals to those organizations. We need far-reaching tentacle within community. And that can't be done by one organization. It has to be done by a collective of organizations. And so, as I said earlier, you might be providing services in this one area, but we know if people don't have the fundamental source of food, it's hard for them to experience or move or thrive anywhere else. So I think from the standpoint of what I would say is make sure we partner and collaborate. Extremely important, particularly in these times when we have changing requirements. And the more you do that, the more your organization becomes aware of what the new requirements are. And not that you're doing the work that the NOOP coordinators are doing, but you serve as an ambassador to the information. And lastly, I will say, for those NOOP coordinators, make sure you have a really good collaborative relationship with your local departments of social services. So you can help to triage applications when there's a denial. You can help to ensure that you have lines of communication open when you have a question. And from the local departments of social services, especially particularly in our area, we're seeing a decrease in staffing. So our work is so critical to making sure that when those applications get to the local Department of Social Services, they're complete and accurate, because then that reduces the time frame that your social service examiners have to spend on actually reviewing applications, because they're complete, accurate, and they can approve applications quicker. And what does that mean? That means getting benefits to people quicker that they really need and deserve.
And that's a wonderful closing. Thank you so much, Vanessa. So I want to give a big thank you to Whitley, Lindsay, Vanessa for taking the time to speak with us today, for the work you all are doing every day to connect New Yorkers with the food benefits they need and deserve. Thank you to Emilia for sharing her work on better understanding the SNAP gap here in the state. And thank you also to the audience for joining. We'll be sharing a recap with a link to the recording and any other kind of materials and links that have come out during the conversation following the event. So thank you so much and have a great day.